Welcome. In this Sympliact demo video today, we're going to look at the practice app and more specifically, we're going to look at the workflows that a provider would go through as they're delivering and documenting care. A little bit of context, these flows have been really intentionally and purposely designed and built to make them as streamlined, as simple as possible so that we can focus more on delivering care and less on the administrative aspects of care. Another piece of context, I'm on using an iPad for these interactions. So a lot of these interactions and navigations are going to be using a touch screen, which makes them very, very quick, very, very easy, and very user-friendly. Third piece of context is this appointment that we're going to kind of walk through is for a patient who's already been seen for a consultation appointment prior and is back today with us for the procedure that's planned. So to get started, we're going to go through the flow in kind of a real-time perspective. There'll be a follow-up video where we dig into some of the details at each of these steps so that you can understand the deeper levels of functionalities available to you. So in this case, I'm the provider. I'm here on my daily patient schedule, and I see an appointment scheduled for Jared Jackson at 10:15. I'm going to click on the screen over that appointment block, which is going to result in a pop-up being shown to me, which gives me some additional details about this appointment. And along the bottom, there's some buttons. I'm going to click to go directly into the care thread. So the bottom right button. That brings me to the thread specifically associated to this appointment. So I can review past details on that thread. If I scroll up a little bit, I see that on December 14th, or 4 days ago, we did an examination or a consultation on this patient, and the plan at the end of that note says that today we're removing 230, grafting site 30, and doing that with IV sedation. So I would review that with the patient as I walk in the room to confirm that that is indeed what they remembered the plan being. And if we're in agreement and the consent matches, I'll then navigate to the health history tab. So 2 tabs to the left of care threads at the top of the screen, I'm going to click on health history. I can review that health history that it shows that we confirmed 4 days ago with the patient. So first section is allergies. If nothing's changed, which it likely hasn't in 4 days, I can click the little I at the top to confirm that section as still being good and complete. And then we just work down through each of these sections with the patient. Any changes in the medications? No, we'll confirm it. Same with the medical history, we'll confirm it. We also see that under diabetes, there's been some details added, so I can hit show notes, and I can see data that we've entered in the past on diabetes control, etc. But we can hide those notes to, again, keep things as clean and as easy to interpret as possible. So we continue through this health history flow, and we confirm that everything is complete. After I've reviewed and confirmed the health history, I would then navigate back to the Care Threads tab, back to our exam node. At this point, we're ready to proceed with the procedure. We've reviewed our past note and plan. We've made sure that matches the consent. We've reviewed and confirmed the health history, make sure that everything's complete there. So we do our procedure. At the end of the procedure, it's time to document care for today. So the way we would do that, I'm going to swipe on the right side of the screen. And let's go back to our procedure template. So we have our templates. In this case, I'm going to select extraction graft. I can copy that, paste that into my notes field at the bottom, and then we're going to go through that template and make any indicated changes. So in this case, we'll update the sites that we worked on. So it was removal 230, graft site 30, and we did that with IV sedation. We now come down to the body of our template. Many times for these templates, nothing is going to be different than what our template says, but let's say in this case, it ended up needing some ostectomy, and we had to section the tooth, let's say, and we had to do a little bit more than our just base template involves. We can add that detail very quickly, and we're done. Move down to the disposition section. In this case, the kind of default status on or state on this template is to follow up in 4 weeks. In that case, I'm going to leave that, but obviously I can update that. And then we'll update any prescriptions that we may be sending over today. And then that's it. I'm going to hit send. That procedure note's posted to the thread. And now I'm done documenting care in a very quick, easy, accurate fashion. At that point, what I would do is I would navigate to my dashboard. So I'm going to click dashboard at the top left of the screen. And then in that case, we're done. We completed care and we've documented care. So I'm going to hit the write status node, which is essentially going to close that appointment out, and it drops off my dashboard so I know that I'm complete with that appointment. I've treated the patient, I've documented care, and then again, in a very quick, streamlined, smooth fashion, we have delivered care, we've documented care, and we can move on to the next patient or be done for the day in this case, let's say. So that's a quick overview of the provider flows. Again, there's a lot of deeper functionality in each of those steps that we'll look at in the next video, but I just kind of wanted to show how quick and streamlined the process of delivering and documenting care in Sympliact is for a pretty normal, common provider flow for a procedure appointment. So hopefully this makes sense. As always, questions, comments, anything along those lines, don't hesitate to reach out to us at any time. Thanks. Bye.